Okay, week 8, journal 8. Describe a significant event, patient interaction, never seen diagnosis that you've experienced in clinical this week. Discuss the impact it had on you and the terms of increasing your understanding. I had a patient who her boyfriend broke up with her. Her mom left her when she was younger. Her dad's in her life, but she came in because she just couldn't understand why her boyfriend broke up with her. She said that she can't eat, she can't sleep, she can't do her job. She is just extremely upset over the breakup and she wants medications. Well, the more we talked about it, the more we talked about why the boyfriend broke up with her. She said that she actually tried breaking up with him multiple times. He would leave the house, and when he would leave the house, she would break up with him because he would leave the house. And I asked her, why would you do that? And she's like, well, I just figured if he was leaving, he probably didn't want to be with me anymore. He probably just decided that I wasn't good enough. And I would break up with him. Well, finally, after she broke up with him multiple times, he finally said, enough. I don't want to be with you anymore. I can't do this. So she couldn't understand why he left and why the abandonment, why he would abandon her like that. And she just can't believe it, that people would do that even if they care about you. And they say they care about you, and then they do something like this and they leave you. She was very upset, crying during the appointment, said that she hasn't been able to go to work. She hasn't been able to do anything. She didn't pay her rent this month. She didn't get groceries. She's just been sitting in her house, eating and trying to call him. She calls him and texts him over 50 times a day. She tries calling him at work. She threatened his job. She told him that she was going to tell him his job that he did something illegal to try to get him fired. She's called his parents. She's called his sister. And now she's finally here to see me. Well, never seen before diagnosis would be borderline personality disorder. I tried to explain to her the different things we can do, but I did want her to be in therapy to do DBT, and she wanted medication. Wasn't really sure what to do with that. So I did start her on an antidepressant because she had no motivation to do anything, even though a lot of times borderline personality doesn't do medications. And I understand that, but I feel like she did need some motivation and some help to get back on track, to understand that what she has is a disorder, and she does have depression on top of borderline. So I did treat her, but I also referred her for therapy for DBT. I think the patient role, provider role went well. I think the strengths was I understood what was happening, and I understood my limitations. What was I really couldn't give her a lot of medications or a lot of options for medications, because a lot of times it can't be helped with medication, but I did find medication to help with the acute depression and then get her to the right person. So learning insight is borderline personality disorder does happen. Something that I've learned is that they really do have a fear of abandonment, but yet they push the people away that are close to them. So a very good learning experience, and I think I would apply the same learning to my future practice. Have a good night.